And I'd like to bring up to the stage Cesar Cocco, and he's going to talk about YouTube videos, a really hot topic, and most notably, how you can use this in the pharma space, in the pharma vertical.
I don't think I need this, but I probably need this.
Sure.
Thank you. Hello, 1, 2, 3. You guys can hear me? How's everybody doing? Good, good. I want to kick it off by saying a big thank you to our panelists. I think it was amazing to hear the perspective of actual real-life doctors speaking towards the work that Google does, not only for your day-to-day roles, but also in the mindset of the patient. And we'll talk a little bit more about the modern patient soon. Another big thank you to our AV teams and our caterers. I hope everyone's having a great time and enjoying this beautiful space, so a big applause. And finally, I want to say a big thank you to all the Googlers that make this happen. We have to coordinate with a lot of different teams within Google. Sophie specifically, we heard from her regarding the human truths POV at Google and that shift to health as wellness. And they are by no means at all entitled to answer our emails when we ask them to come to meetings like this. But one of the reasons that they do is because of the strong partnership that Silverlight Digital has with us that allows me as their agency development manager to kind of maneuver around Google as an org and deliver on these amazing value adds. So today I'll be talking to you specifically about YouTube channel strategy. I'm assuming that everybody in the room has heard of YouTube. Awesome. Either you had like a pesky Googler calling you, trying to pitch YouTube or get you to sign on to the platform, explore for the first time, or if you're super lucky, you work directly with an amazing YouTube partner like Silverlight Digital to launch an incredible strategy. Regardless, today I want to talk to you a little bit about YouTube channel strategy. And before I dive a little bit deeper, I want to ask the room, how many of you have an active role in the management of your brand's YouTube channel strategy or a brand's YouTube channel strategy? Okay, that's like a lot of people, so now I'm a little nervous. I think YouTube channel strategy is super fascinating. So it's not part of my core role here at Google, but it's so interesting to me to watch this platform flourish into a storytelling portal within the modern patient journey. So it's all about curating stories, and that's exactly what your YouTube channel should be. You want your modern patient to arrive to discover information about your brand and about their condition, but also discover things that they didn't even know that they needed to discover. So this is the kind of like the DNA of a good YouTube channel strategy. But by the end of this conversation, I want to break it down for you a little bit further and help you understand ways that you can improve your organization's view or support system towards that channel. Sound good? Great, and I also understand I'm like the only thing standing in the way between the happy hour, which is quite intimidating here, but let's do this. So is a YouTube channel right for your brand? I can't decide that. I can't tell you. Nobody in this room can tell you except for yourself and those peers within your org that you're cross-collaborating with. So we'll talk a little bit about some ways that you can get to that decision. And then we'll move into the pharma basics. We'll talk a little bit about what the main strategies that most pharma advertisers are utilizing in order to create the overall vision for the channel, right? So it's not the same if you're a makeup influencer as it is when you're a pharma brand. We've heard a lot about compliance, important safety information, and all this stuff, which plays a big role in how you set up your YouTube channel. Then we're going to go into some best practices, pretty basic stuff. So about thumbnails and what you should do if you find yourself on scene at the set where you're shooting all of your content and generating assets. We want to make sure that those are properly aligned for the best practices that we see at Google. We'll move into a deep dive into subscribers, why you really want to support or create a support system to generate subscribers versus just having more or less a dumping ground of content. That's aggressive. But yeah, you'd be surprised at how many brands kind of don't really maximize the subscriber strategy as well behind the channel. Finally, we're going to talk about another one of my favorite things at Google and severely underutilized, which is YouTube Analytics. And I can see why. You have like Google Analytics, you have the metrics that you can see in Google Ads, and you have all those third-party partners that can give you data. But I think YouTube Analytics is a really powerful platform to be able to get you more insights into your audience. So is a YouTube channel a good idea for your brand? So again, not enough brands ask this question until it's too late. So let's first take a step back and talk about why a YouTube channel is created. It's a great place to direct patients, healthcare professionals, and caregivers towards like a destination. So it's a treasure trove of content that a brand may have, and you're giving your potential patients a destination. So it's as simple as that. It's also a good idea to have a presence on the world's second largest search engine. People sometimes look at YouTube as sort of like this non-search monster, but it really is really intertwined with search in so many ways. And so keep in your back pocket that YouTube is the second largest search engine in the world. Finally, and this is me being a little bit of a babysitter, it's a requirement for you to have a YouTube channel in order to advertise and buy YouTube ads. So it doesn't have to be public, but it does have to be there. So again, having a YouTube channel is not about checking the box. We see too often times that it becomes sort of a dumping ground for whatever content we're not using for other projects. So be super critical about what you're putting on there, and we're going to show you some ways how to do that. One of the reasons I really love YouTube is because it's providing context. It's in this unique intersection in our lives where I feel like it shows us what we want to know, but also what we don't want to know. So it's a strong discovery tool. And you as advertisers or marketers have an opportunity there to curate your story in many different ways. And also, most importantly, I think somebody earlier talked a little bit about that difference between reading words or reading a brochure versus actually being in the moment with an audiovisual experience, perhaps watching another patient deliver a certain procedure or interact with a certain medication via YouTube and get a sense of them being there and relating and having that human touch. Again, patients really prefer watching the videos versus reading brochures. We just spoke about that. I'm not going to show you this video because it's pretty straightforward. What you're going to see here is an opportunity to learn in other ways other than reading, which is so boring. Well, I like reading, but I mean, at times when you're trying to really have things get sticky and learn and be in a very emotional state as someone maybe who's experiencing a new diagnosis or is symptomatic undiagnosed, this is a great place for really for us to manage that anxiety. I think we heard that a few times before today. So strategy, YouTube strategy. It lives in the intersection of what people are searching for, what they're interested in, and where your brand can lean in. It's as simple as that. The overarching goal here is to educate your patients or potential patients, to inspire them, and no matter where they are on their patient journey. Your channel needs a lot of support. If you're going to go through the effort of setting up a channel, you want to make sure that people are opting in to watch the content and that you're boosting the organic discoverability of your channel. And one of the ways that you can do that is to have eyes on your YouTube channel. It's as simple as that. So invest budget into your YouTube channel. There's a lot of ways that you can also remove silos internally to make sure that you have different kinds of perspectives within that strategy development. So don't make content that only your PR department is going to see. So I'm going to show you a little bit more about what the current pharma space looks like. I'm not advocating for any one of these strategies over another. I want you to think critically about what may work for your brand or a brand that you're working on, but we are in no way advocating a specific type of strategy here. So we're going to kick it off with this example of ILEA. We have a branded channel with branded video content. It's pretty straightforward. This is like the highest level of transparency that you can provide through your YouTube channel and to your value prop. Any questions there? No. Now we have the unbranded channel with branded video content. So really what we have here is an opportunity for you to showcase your branded video content within the channel, while also kind of showing a nod towards like, you know, the condition itself and your interest in really fulfilling the appetite of the patient's knowledge journey. Next, you've got the black box unbranded channel, and it has branded video content, but in this particular strategy, the brand is listed within the important safety information on that video content. So it's not something as readily visible to new watchers, but it's definitely something here that some brands have been seeing incredible success with. It kind of seems a little bit sneakier, but I'm sure that it's something that we want to keep in our back pocket at one moment or another for various degree of reasons. Finally, we've got an unbranded channel and unbranded video content. So here, basically, you're trying to really speak to the appetite of like full just knowledge sharing. So, you have your value prop, you know where you're sitting as marketers, but you want to make sure you're providing your YouTube watchers an experience that really isn't influenced by that value prop as intensely. So these are some of the strategies that we've got, and underlying all of them, keep in mind that you have two compliance kind of options there. So the first one being that you can include your safety information within the video assets itself. Or you can feature it within your video descriptions. And lean into the resources if you're already working with Silverlight to be able to guide you through the free resources at Google that can help you optimize and realize YouTube videos. And that's a lot on the paid media side, but also within your channel. We have a lot of great resources that are only available through the work with Silverlight to kind of audit that channel and its integrity. Compliance is so fun. Finally, we're moving into the channel optimizations and best practices portion of this presentation, which may seem a little bit basic, but we really want you to understand the most common, like top-level strategies here, and how boost your brand from an organic standpoint. So your channel description, simple enough. Here, you want to be very, very, very specific about how your channel will educate, relate, and inspire. So here, really be as specific as possible. It's the entryway, it's the portal into the watcher's interaction with your brand. Finally, we've got the channel trailer here, which is really interesting. It's the first thing that unsubscribed viewers are going to see. So you want to hook them as quickly as possible. So in addition to hooking unsubscribed viewers, you want to turn them into subscribed viewers. So they're subscribed to your channel, and in this way, you're building lifetime value through your channel strategy. Here, we highly recommend to use your most engaging content for obvious reasons. So here I want to deep dive into what we're viewing as the modern patient journey. And this is really important because it's really going to define the way that you create your content strategy and the way that you're going to structure it. So you don't really need a separate channel for each of these interactions, but think of them as like different tables at the bookshop. Does that make sense? So for example, you have watchers who may be in the symptomatic undiagnosed portion of their journey, or they're diagnosed but not on therapy. So think about all the opportunity to build a storyline with the modern patient across each area of this journey and really align your organization towards the different goals and KPIs you have with what the audience is going to respond to. So, sections. This is a really interesting area of the channel strategy because here what you really want to do is utilize the modern patient journey in a way that really orders those sections for each of those categories. So if you're diagnosed non-therapy and that's the person you're trying to message, or on therapy looking to switch, that's a totally different ballgame, and you have an opportunity to kind of connect that to the full funnel that Ruth was talking about earlier and align those strategies through how you're actually sectioning off content within your channel. So again, each part of this journey should not necessarily be a channel on its own, but it should be a section within your channel. We also have playlists. Playlists are really great. It's an ordered list of videos that you can curate for watchers. And it also can appear in search results and suggested videos. So this is a great opportunity for you to sort of own your channel and include videos from there, but also kind of give a wink to all those other channels that you really enjoy and that you respect as a brand. And in this way, you can more or less start building your community on YouTube and show that you're a team player who's most interested in what's best for the modern patient. I guess the bottom line here is that your playlist should keep people watching longer. Love a good playlist. Let's move into the thumbnails here. They drive organic views. This is a great opportunity for you to collect the best asset that you've got and optimize it for mobile, since remember that 70% of the time users are watching this on mobile and they likely have turned down the brightness on their phone. So when you post these thumbnails, when you work towards the thumbnail strategy, make sure you keep these mobile first attitudes in mind. Choose an image that's unique, and when we go back to what I mentioned earlier regarding the human touch, it's really good to show faces. People love faces, and people really connect with faces. So think about that when you come up with your thumbnail strategy. Finally, we've got titles. I'm sure all of you have searched for something on YouTube and saw like something all in caps. All in caps, kind of like wacky, all out there trying to grab your attention, command it. Keep it classy. So try not to utilize all caps by any means and be as brief as possible, because YouTube is only going to be showing the 100 characters within these titles. So try keeping them under 70 usually is the best practice, and focus on the most important words at the front that you're trying to leave an impression with. So the description should only be the first few sentences of your description as like the main focus, because these are the only ones that are actually going to show. So here you can include additional relevant safety information. You can include other resources that you'd like your patients or the modern patient to interact with. Here, also a really good idea is including one of your playlist links so that you can continue to build that subscriber base. Speaking of subscribers, why are they so important? Not only do subscribers build up a sense of community, which I feel like today and age we need more than ever, both online and offline, it's also a great opportunity for you to build up your visibility. So subscribers are watching 2 times more videos than non-subscribers. So this is generating more brand awareness for you. This is also generating a higher lifetime value from those watchers. So they watch more content and for much longer. We'll talk a little bit about how you can use YouTube analytics to analyze that more deeply. Subscribers also provide really valuable insights, more so than those watchers that are unsubscribed. So different patterns will start to emerge once you have a strong YouTube channel strategy from those subscribers. So you'll understand a little bit more which audiences are more likely to watch, so you get a lot smarter about your content strategy. We give the example here of Pfizer subscribers versus Pfizer non-subscribers and those kind of top video subjects. So you can use this information in a variety of ways. Oh, that's a perfect segue as well. So here's the process, the big picture. You post a video to YouTube. We know how to do a really good video now because we talked a little bit about how you can really optimize that. And then you analyze that video in your YouTube analytics platform. You uncover those insights that are really valuable for you, and then you optimize your creative based on that. What does that mean? So let's say you notice a major drop-off every time you show a chart. So that's a great next step in AI that you can take to your team or your higher up and develop into your next round of strategy. It could also be maybe like a landscape shot that doesn't work as well as like a human phase. So what you want to do is you want to put the most important information that you're trying to communicate before that landscape shot. It's all about getting sticky. So what's really interesting, and another thing that I really love about Google is the audiences and the targeting aspect of digital marketing. So I think what's really interesting is that when you're working with brands that have a strong idea of who their audience is, at Google, we can deliver on that. But what's also even more interesting is that Google products such as YouTube Analytics can actually tell you about other audiences that you didn't really quite expect. So we can give you information regarding whether these audiences came from paid strategies or organic, age, demo, location, geo, all these things. But then you can also see kind of that intersection in between what these people's affinities are. So your brand's audience, what else are they interested in when they're not kind of in that modern patient zone? What kind of videos do they watch on YouTube? Do they like ABC, or do they prefer to get their news from Fox? Cool. Short and sweet. So to recap for you, I want you to have support for your channel by making sure that you have awesome assets, an amazing strategy and budget, and that conversation is ongoing within your organization or with your agency partner. Dive into the spectrum of all those branded and unbranded combinations that you can utilize for your overall arching YouTube channel strategy. And also make sure that you're consistently encouraging those subscriptions, because these modern patients generate higher returns. Use YouTube Analytics. If you don't know how to use it, it may be a good time to talk to Silverlight and get that consultative approach towards YouTube Analytics. And also, quite frankly, most importantly, tell a good story. Make sure it's compelling for the modern patient, and make sure it's keeping into focus all of those things we've learned today, from the doctors on the panel, from our Human Truths department, from Ruth on conquesting, and also from Peter on measurement. Because all these things are the backbone towards an amazing, amazing 2020. But definitely at the core of it all is the quality of your story. Great, so I have some time for questions if anybody has them.
Right here. You could say your name and where you're from.
Sure. Hi, I'm Jennifer from Create NYC. And my question is, it seems like all of these platforms really require customized content, right? So YouTube needs its own YouTube video, and then for Facebook it's separate, and then for Insta, it's something else. So my question is just, how does a brand who is perhaps limited on funds really take perhaps one video, perhaps it's their DTC campaign or just some patient testimonial video, and really customize it for each of these brands when you really only have one source of content?
Got it.
And how do you kind of address, so for instance, how would a YouTube viewer, what are they looking for versus the other platforms?
Okay, if you don't mind me asking, where do you sit, on the creative agency side or the pharma brand side?
On the agency side.
Okay, awesome. So this is the conversation where sometimes creative agencies look at the Google resources around this area and kind of go, oh my God, they're like stepping into my territory. And I'm assuming that you're going into the Google Ads or YouTube Ads space optimization of the actual quality of that video. Is that correct?
I'm actually not doing any of. I'm not.
Okay.
I'm just curious because I know that it's been drilled into us, like Facebook needs these types of videos.
Got it.
But how do you play in YouTube as well
Got
in
it.
a way that it's not duplicating efforts?
Okay, great. So I would say that lean on creative agencies whenever you can. They're incredible partners to help you develop your overall YouTube channel strategy if that's a service offering that they have. And if not, or if the focus is more on the actual paid YouTube video side, we have incredible value adds that we offer up to partners like Silverlight Digital that not everyone has access to, where we can take your videos and we can make them YouTube friendly. But what makes a video friendly for YouTube ads doesn't necessarily mean the same thing as what makes a video friendly for your YouTube channel. Does that make sense? So yeah, we do have a lot of resources there. And I also think that it's really important for you to start kind of maybe stretching a little bit more and leaning into that automation on the creative side, because as creative partners, you have a very valuable role in the process. But I think it's only going to be amplified if you're leaning into the new automated technologies to develop your creative vision. Thank you for your question. Hi.
Hi, this is Joey from BMS.
Hi.
I have a question on the YouTube ads. So if we want to run the video campaign on YouTube, like pre-roll or mid-roll or something like that, can we select the audience? Because I don't want to target anybody. Sometimes I want to target HCP. Sometimes I want to target the patients and caregivers.
Yeah.
Does YouTube support something like that?
So audiences. Amazing. You should use them on YouTube. Actually, I think right now in today and age, we shouldn't have a YouTuber search or GDN or display focus. We should have an audience focus and find them wherever they are. So what does that audience look like, and who are they, and can we speak to them? We are within a space where we are working extra closely with Silverlight because we understand that there's many restrictions across the retargeting space when it comes to pharma. And that's very serious. I wouldn't want my significant other to find out about some of the searches that I'm making, and so it may be an issue if we share. No, really, if it may be an issue if we share a device. So this is why we have to be more strategic about our audiences, and there what you can do is come up with an incredible first-party audience strategy. We heard Peter talk a little bit more about how you can take your prescription audiences and kind of fuel that pool of users within the online space. I think that's there's potential there. And I think that you could also look at what kind of audiences are really valuable to you as a brand outside of the retargeting space. So for there, I also recommend to have a strong audience support structure within your org. And if you don't, lean on partners like Silverlight, who can provide you with a big picture of what Google audiences can do for you versus Facebook versus another company like Criteo or something like that.
Or Twitter or something like that.
Yeah.
Okay, thank you.
You're welcome.
Got one more over here.
Hi, I'm Marsha from Habas. Hey.
Oh, hi.
Is there a specific use case where a brand shouldn't necessarily have a YouTube channel that you would recommend not having one?
Not having a YouTube channel?
Yeah, pharma brand.
I think that there is something to be said about the strength and the power of like offline strategies, like more traditional strategies like TV and these other things like billboard and radio. However, I don't feel that right now at this time I see very much reason to not have digital, at the very least, as an extension of the voice of what you're trying to say on traditional channels. Now, I don't know off the top of my head where this can maybe be a little bit less appropriate, but I guarantee you, after what we've heard today, that almost everyone with any condition is leaning into YouTube as a knowledge source and as a decision maker, including doctors and healthcare providers alike. So, yeah. Thank you for your question.
Hi, Rebecca Rivera from United Therapeutics. Just looking if you have any insight into what is a good length of a YouTube video.
Got it. So I would have to kind of turn this back around on you and say, like, what are you trying to say? So I would try to look a little bit more deeply into the audience that you're trying to reach. Let's kind of put this into the perspective of the modern patient journey. What segment are you trying to really hit with that creative? And then also try to understand a little bit more on like how that part of the funnel is interacting through YouTube analytics. Like if it's more of a mid-funnel storyline there, I may use a different tactic rather than someone who's really bought in and very likely to complete that view. And to be honest with you, I think it comes from experience, right? Because then you kind of can lean into your watch time stats within your YouTube analytics. And also do fun things with those metrics across like other platforms and things like that. Does that answer your question? Great. Okay, great. I think I'm going to bring back Michael to wrap things up, but thank you very much for your time and for coming.
Okay, thanks, Cesar.